My name is Dr. Julie Keene, and I am one of the 3 associate vets at VZ Veterinary Clinic. Many people are really worried about the anesthesia that we need to do for surgeries and for dental procedures. And I think in particular with dentistry, people feel even more nervous because in some senses a dental is often an optional procedure. In other words, you're not forced into doing it. There's not an emergency situation, you're choosing to do it. And so then the anesthesia component becomes more worrisome for many people. So I just wanted to talk a little bit about what we do to make anesthesia safe. We do the same monitoring that is done on any people when they are in the hospital. We do preoperative blood work to make sure that the liver and kidneys are functioning well before we think about anesthesia. We use an IV catheter or a catheter in the vein during surgery so that we have access in the case of an emergency. We can give medication immediately, but more importantly so that we can run fluids during the procedure, which helps to maintain the blood pressure. Low blood pressure is probably one of the bigger risks of anesthesia, and so we do a lot of things to try to prevent that from happening. Other things that we do to make anesthesia safe, we maintain their body temperature with a circulating warm water blanket. We monitor we do an ECG during the surgery. We monitor their body temperature. We monitor their blood pressure, their heartbeat, their heart rate, their breathing. We have a tube that goes down into the trachea that protects the airway, and we use gas anesthesia to make it safer during the actual procedure itself. We also use a multimodal approach to the drugs. We use actually a combination of drugs, and while that would seem like using more drugs would make things more dangerous, it actually makes it safer because we can use less of each drug. Where you get into a dangerous situation is if you use a lot of one thing, and then whatever that one thing is, the side effects are magnified. So if we use a little bit of a bunch of different things, we can balance the negative impact of each drug and overall have a much, much safer anesthetic event. We also tailor the drugs to the patient. So if we have a particular patient who has a particular medical condition or has a history of a problem with a certain drug, then we tailor it to that patient so that we are making it as safe as possible for them. They also have a nurse anesthetist who's monitoring them throughout the entire procedure, and we keep track of it in an anesthesia log. So when you look at it all together, we're really keeping a close eye on every vital system during the anesthetic process, and we find that our patients will fall asleep smoothly and have smooth recoveries, wake up quickly and be able to go home, maybe a little groggy, but almost back to themselves that night, making it much